Well, hello and welcome, and obviously we're looking at the World Health Day, and this year's theme is universal health coverage, everyone, everywhere. How broad? We're going to look at our situation in Ghana. How feasible is it that everyone, everywhere can get even basic health care? Is it one of the things that is, far reaching beyond what we are doing now, or something that we can achieve? Indeed, if you've been to a hospital lately, or if you've listened to some of the complaints lately, it tells you that even those who have access to healthcare, some of the treatments they get, it's the least said about it, the better. But that's what we're discussing today. You will join us on the phone, you join us on WhatsApp, so you can tell us as to what healthcare is. If you are crying and stuff like that, you are okay. But those of you in the hinterlands, what is healthcare like? And we would like to hear from you. My name is Dana Sakwa, Chief of the Little Republic of Akomodibasa. When I come back, we're discussing World Health Day and how it is that healthcare can go everywhere. Don't go. Well, thank you very much for staying, and my guest today wears many hats. Cecilia Lodonu Senoo, a member, Coalition of NGOs in Health, and also Executive Director for Hope for Future Generations. She's also President for Non-State Actors in Ghana, all within the health facility. So she's a good person to talk to. Cecilia, welcome to the show.
Thank you very much.
World Health Day, this theme, considering that we're signed on to WHO, how are we going to achieve this?
Thank you very much. World Health Day, universal health coverage is the theme, and the slogan is health for all. And it's also saying that health coverage, everyone, everywhere. That means everywhere, everybody, wherever you are, must have access to health. And when you talk about universal health coverage, you remember the alma mater some years back, about 40 years ago, when Ghana also signed to alma mater, meaning health for all at their doorsteps. And so when we talk of universal health coverage, that means primary health care, basic health, that is acceptable, affordable, and accessible to people who need it. And so when we talk of universal health coverage, which is WHO slogan, making sure that the whole world cover this, then we are looking at health financing, we are looking at equity, we are looking at accessibility. And so that is what we mean by that. And 40 years, we expect that we should all have access to that. Primary health care is one of the things that we all grew up to know. But when it comes to actually assessing it, it's difficult. Ghana has developed CHIP system. You know, the CHIP system that we all have is health service at the community level, where community members are involved to take decisions for their health issues. And we have something called community health committees, made up of community members, health people, civil society, community traditional leaders, all of them coming together to take decisions for health. If we were to implement that effectively, we would have been somewhere. But I think we have some gaps, and then we have to discuss that. And so currently, when you talk about our health, today I was listening to JoyNews when I was traveling to the office, and I heard a lot of people talking about their challenges. And so we still have a lot of problems in this country when it comes to health. I know there has been a lot of investment, but where are we now? I mean, we still have challenge, and we need to discuss that and see the way forward.
We'll come back to it. This is because you brought joy. Let me divert a little bit and come back. Even those who have access to healthcare, some of the reception they meet or the treatment they get, it's you know, you just can't understand. Is it that the person working at the hospital is so overwhelmed, frustrated, angry? What is, because there's one too many of such stories.
Yeah. You know, universal health coverage, one important thing is the workforce, human resource. And if you want to have universal health coverage, apart from health finance, which is national health insurance, then the health workforce play a very key role. And so we are looking at motivated health workforce who have access to all the equipment they need, who know how they have the capacity, they understand. And the important thing is commitment. Understanding, why do you go into nursing? Why do you go into health? Is it because I don't have a job? Is it because I don't have money? I think it's so sad to know that the health sector or the healthcare providers think that they are doing service to people who pay for it. And unfortunately, people who really pay for it, for example, if you pay for national health insurance, you are paying for a service. And if I pay for service, why do I beg you before you provide that service? And we have something called Patients Charter. Patients Charter give the right to anybody who falls sick and then access health facility and must be given that care. If you look at Ministry of Health and Ghana Health Service, their objective, their goal, health for all, they are there for you. But you go there, very sick, people don't understand you. We don't have motivated health workforce who are ready to provide that service. And that is a big barrier to achieving universal health coverage.
Okay, so now let's look at, in terms of coverage, we talked about cheap compounds where, you know, unfortunately we live in a country where the building itself, that's it, I provided a building, you may have no staff, no, you know, facility, but come 4 years, vote for me because I provided it. So there are so many of these dotted around that are not, you know, functional. Yeah. What's the way forward, or what do we do about them?
The sad thing is that, you see, if you look at how the CHIPS system is developed, it is for the health care provider, move to the community, move to the household, and let the communities have access to them. But when you put one health provider, maybe community health nurse, in to serve about 5,000 population, how can that community health nurse reach out to those people? And so she has to sit in the clinic, and the people rather move to her, and so she has become a small clinic. Now we got to know that most of our health, the CHIP zones are not functioning. I think about 200, they are there, but they are not well equipped. And if you look at the human resource, inadequate. Resources to really make them work ineffective. It's not even there. And so at the end, the universal health coverage is not achievable. What is happening to our national health insurance? It's not able to pay to the providers who are providing the service, don't have the money. And they are doing their business, the private sector, the public sector. Now a lot of people are moving to private sector because you are not getting what you need from the public sector. People who can afford. What about the poor person in the village somewhere who cannot even get money to eat? And so you realize that assessing health is a problem. Achieving universal health coverage, there are so many things that we don't have. Recently, you hear shortage of vaccine. How can you give birth to your children and you cannot protect them from diseases? And we all know the importance of vaccine for children. We cannot depend on donors to take care of our children. I think it is important that we invest a lot of resources into this because they are the future generation. How can we get our children? You give birth and you cannot protect your child from preventable health. Looking at universal health coverage, I mentioned few things. There is health technology, there are infrastructure. We have the infrastructure, which you rightly said, the people to provide the service are not there. And so there are so many things that is happening that I think that we need a whole national dialogue when it comes to health.
Let me take you on the national bit. Something which baffles most people is that, you know, the top hierarchy who could really sign with their green pen and make a hospital first class will be quickly jetted off outside of the country for health services. And sometimes the treatment that they go and get, you could tell that if that machine was here, or if the doctor here had just done a 6-month course, he would do the same, provide the same service. But we never seem to do it. Like you said, 40 years and probably even longer, we never seem to do. Is it a culture? What is that block that makes it look? Kolebu should be first class, or 37 should be first class, so that no matter what it is, you can go there and you'll be okay. Because the top hierarchy, as I said, will quickly fly off and go and get healed.
Yeah, it's rather unfortunate. It is unfortunate because the people who have it have other places to go, and the people who don't have it remain in this country. But they put you there. They invest in these people. If you look at the tax that everybody is paying, the poorest person also contributed to their education. But it has become, the whole country has become like money. I mean, for me, anytime, today we launched this, People's Health Movement launched this. It was so disheartening to hear the stories that a lot of people were sharing there. If I cannot afford to take care of my own basic health, why should you? Maybe, let me just give example, politicians, or maybe the technocrats, because you have access to the tax that we are all paying or contributing to develop the nation, you have access to it, then you can fly. I think it's important that we develop our own infrastructure, our own nation, and all the necessary things that we need to make basic health. You see, when the national health insurance started, we didn't invest a lot into preventive health. We were focusing a lot on curative, but we all know that prevention is better than cure. Why do we wait for people to fall sick before they go to hospital? Why don't we make basic information, education accessible to people in the community? Why don't we invest a lot into community health workers? Why don't we invest in traditional leaders? We work a lot with queen mothers. We work with a lot with chiefs, and I know how they have social control. Because if the chief summon, you are one of them. If you summon your subjects and you have the knowledge and you tell them, look, if you wake up, take fruits, take 1 orange, 1 banana, don't take breakfast, or go to your garden, eat this, they will listen. Why do we have to wait for a health person to come from somewhere? Why don't we invest in the community, give them the information? Why don't we partner the community structures to make sure that basic health is accessible? A lot of people come to Ghana to learn from us. When we started the national health insurance, people come here to learn, and then they go back. Ethiopia has become a whole story, achieving so much. When you talk about universal health coverage, working with community structures, Ethiopia is one of the examples that everybody will talk about. Everybody talks about Bangladesh. There are African countries, even Kenya, basic, they come to learn from us. What is our problem that we cannot really develop our own and sustain it? And we still depend on everything that comes from somebody. I think we have to start. We are gifted as a country. Basic things that we can do, we must do. We must look at partnership. We must look at, it is not only health. Health is not only for doctors and nurses. We must really play our part. And whatever we have, the basic health, for me, or civil society, I'm a civil society, I'm a community person, I believe that investing in community structures, investing in community-based programs is the sure way to go. It is not the big structures, it's not the expensive things. We must make sure that basic health is accessible and affordable to the people before we start thinking of curative.
I think what really caught me is this preventive thing. I was going to go education, but I think that's the word, preventive. We seem to wait and then go for the cure. Because as we speak now, as soon as the rain start coming, we will sit and wait for cholera to come, and then we start rushing. But we don't see people cleaning the gutters and doing that thing. We have really fallen short on that side. We have. I mean, you see, if you sit down in this country and you see a lot of things happening, you realize that as a country our problem is behavior.
I mean, we know everything. There is Ghana. If you listen to Ghanaians talking on very important platforms, you get amazed. And you come back from those platforms to your own country and you see what is happening, you get worried. What is our problem? Are we not being responsible? Do we care for our own selves? What can we do? You see, I heard about sanitation. If you say, why should I eat and drop it wherever I am? There should be big, I mean, people should be responsible. I realize that we are not responsible, and we believe that people have to do whatever, but I believe also that charity begins at home. It is what you have been trained to do. The culture of what you should do is what you grow up with, and that is a big problem. And looking at our problems now, you see, we know about basic health, and we decided that we are going to going to invest into chips. How much has been invested? I remember the previous government, they came out and said every politician should invest some money into health, into chips. And I remember former president talked a lot about chips, investing into primary, his salary and other people's salary. Where has it gone to? You understand? And so we look up to donors, and then we wait for people to bring the money. We don't even monitor the use of the money, and anybody anyhow, and then the money gets finished, and then we come back to square one. We cannot sustain a lot of beautiful things that we started as a country. The moment we start, the money comes, we spend it, it's finished, we go back. And that is our problem. We need to monitor whatever we are doing. We must document the success stories so that we inculcate that in our children. As they come back, we are grown. Now, this is the time to invest in these young people so that those bad behaviors and things that we are not able to change, we start them very early, and then they grow and change the country. Otherwise, it's a mirage. Universal health coverage. It's a lot. The word is short, but what it entails is a lot. And we must start looking at the indicators. We must start looking at our health issues, and we must invest and start from somewhere.
I was reading on the WHO, and one of the points you were raising is that the people who are making $1.90 a day, so I mean these are real poor people, and so accessing healthcare is very, very difficult for them. Now, with us, blessed with herbal and alternative medicine, is there any way we can maybe look into it in certain areas so that those who can afford very expensive medicines can fall back on what our grandmothers used to use?
Yeah, I know that health is not, it's partnership. It's all hands on deck. It's multi-sectoral. One person cannot do it. But then, the individual play a key role when it comes to health. Because you can give me all the information, but if I don't put it into practice, from my experience, health is not something that you think that you have to put so much money. That is why I talk about basic health. From day one, you should know what you should do, what you shouldn't do, your lifestyle. You must do certain things. But when you expose yourself to a lot of things, that is it. I also agree that Ghana, we are blessed with so many natural resources. You talk about herbal medicine. We have leaves. We have a lot of things, roots. We can even, I know Ministry of Health started something, and they have a whole sector for traditional medicine. I don't know how we are really using. Look at Mampong. And they produce a lot of drugs. And when I was young, malaria and all those things, my parents used to go to Mampong and buy those drugs for us to use. And it killed malaria. And I think we should do a lot of research and look at it. We don't need to go and take money from somewhere, big money, but look at the basic thing that is with us. And there must be some sort of investment in developing these traditional medicines. And then because Moguchi is there, we have places that can research to ensure that this is the right thing. And then we invest into it. But again, I'm reiterating that basic health, primary health, is a tool to achieving universal health coverage. Because if you invest into promotive prevention, you will never fall sick and go for that. Disease is there, but you can get it when you don't take good care of yourself. Look at, we talk about sanitation. You talk about cholera. If you wake up and you clean your house, you clean your gutter, you clean your bowls, you wash your hand before eating, you drink good water, why should you get diarrhea? Why? So you realize that it is behavior, you see, and attitude. We need to change certain things. You know that my hand is dirty, I have to wash it with soap. Why do you just do this and eat with it, and then you introduce germ into it, and then you start going to toilet? I think certain basic things must be done, and Ghanaians must, you don't need so much money, and we must look at it and partner ourselves. I still say that traditional leaders, community structures are very important. They cannot, you cannot stay in Accra and take decision for us in the village. You have to let us take our own decision, and we must be involved in decision making. That is what civil society is talking about. Involve the communities. We are their voice. Get them, don't take decision in Accra and tell us that this is what you have to do. When you go, we forget about it. And so those are the things we have to do. In the villages, they use their herbs to do their own thing. Popular medicine is one of the important things. And a lot of people, when you fall sick, your mother just walk to the drugstore. I mean, they are contributing to health. And we must develop all those things as a country.
See, listening to you, as soon as you are looking for universal healthcare for everybody, it's like everybody needs to play a part. I'm sure Ministry of Education should be playing a part, sanitation should be playing a part,
transport.
I mean, it's like
multi-sectoral. It's multi. Because if I'm pregnant, it's time for labor. I'm in a village. The road is bad, no vehicle, and I have to deliver. If we know that Ministry of Transport knows that, oh, the village, this thing, you have to partner them, agree for food. You talk about sanitation, hygiene, the extension officer. You see, those good days are not, those things are no more being practiced. If you look at fishery, if you look at veterinary, all those people, we are all part of it. It is not only Ghana Health Service and the agencies. We must start looking at partnership and even partnering the traditional structure, everybody. You see, you don't need doctors and nurses, high-level people, basic. And so you are looking at multi-sectorial before we can move on. Education is important, because if we want to train our children right now, the young ones, to change, you have to break that gap. We have to partner education for them to give that platform and see how we can go. I said that there is a need for national dialogue. No state actors is talking about national dialogue, and we are planning something. We must make sure that we identify the problem, we discuss it, and we move it forward. The talking is a lot, but we must start putting a lot of things into action. When we are signing a lot of documents internationally to take money, we must make sure that we don't just bring the money into the country. The money must be used for what it's supposed to be used for.
I'm going to take a quick break, and when I come back, we're still talking health, and maybe you can join via phone and WhatsApp. I'll put the numbers up when I come back.
He had been receiving treatment there earlier, like 2 weeks before. He was admitted at Kolodi for a few days. So we thought it was to go back there since
Selam's ankle was critically ill. He was too sick to walk and had to be carried in a wheelchair. He struggled to breathe. The first port of call for Selam and his family was the Kolebu Teaching Hospital. A desperate niece needed health care for a loving ankle.
The situation got worse at home. So we weren't coming from any hospital. We just drove straight from home to the emergency place at Kolebu. And then one of the nurses in front there was like, "Where is your letter?" And I didn't know what letter they were talking about. So I asked Butcher, and she said referral letter.
The family did not have this referral letter. They set out to go look for one, this time to the Kolebu Polyclinic. But over here too, the story was not any different. No treatment, for uncle.
So we're just standing, waiting to see if someone would attend to him. So about a minute, I saw there was no action. So I went back to the nurse's station and then I asked, what do we do now? What's the next? And he said I have to go and pay and get a folder and whatever. So I asked for that. They showed me one cubicle like that. So I just went there. And then when I got there, the lady there was on the phone. And I was like, I have an emergency case. And what she told me was, she's on the phone. I said, I have an emergency. So my dad saw me like agitated. So he walked there. And then the lady told the person on phone that I'll call you later. He was really struggling to breathe. Like every breath he takes, he moans. So all of us were worried. So my cousin was actually with him whilst he was in the wheelchair, holding him, trying to calm him because he was really struggling and it was very frustrating for us. So I gave the folder to the nurse and I was expecting them to do something.
Salam's uncle could not hold on any longer. He died.
Harrowing story. One too many. There's just too many of this, and it's very rarely would we hear the follow-up story that they were sacked, they were punished. It's very, very rare.
You see, I talked about patient's charter. In Ghana, we put so much premium on health service providers to the negligence of the patient who access the service. Look at what has happened recently at Senoo, where somebody on retirement has gone to give contaminated injection and kill people's precious children, people. And the poor people are there lamenting, no one to talk. Civil society is raising their voice, know something is happening, but at the end, nothing will happen. You see, there should be some sort of sanction and punishment. People must know what to do. And the moment we start, the law is really punishing these people, the healthcare provider, for negligence of duty, then people will rise up. But it will move, then it will die, because there is no one to speak for you. And this is where we have to rise up. Communities, we should come together. I cannot imagine that a nurse, a sick person has come, or a doctor, I don't know, it's very common among me. I'm a nurse by profession. And you know that you have to pay attention and start giving, immediately doing something to them. And then you sit down, you are on WhatsApp, you are on phone, forgetting that somebody's father, mother, husband, and then the person died, then you just go and cover the face and tell the people that the person has died. It is unacceptable. You see, we cannot continue doing this. There should be some sort of punishment. And when I listen to the censure, I say lack of monitoring. We have the policies there, we have the standard, everything is there, but people push it aside doing what they like. We cannot continue. This story is fine. After the International World Health Day, then it died, then we start again. What can we do? There should be something. We should come together and address this. What is wrong with the healthcare provider, the nurses? Are they really trained? Are they committed? Do they have the equipment to work? That is why I'm saying that primary healthcare is the answer.
Let me put the number out. 0302 211 691, 0302 211 691 or 692. Call in, and particularly if you have a good story in your area. Call in. Let's see if there's a good story in your area. This one says, I recently had an experience at a Tua government hospital, Dumasi. It was good, but more room for improvement. The government and politicians must allow professionals to take control over our state institutions. We are tired of the intrusions and the affairs of critical systems in the country. Do you see any movement in the right direction that you can say, look, in 10 years, Nana, this is where our healthcare is going to be like, and we won't be talking, oh, it looks like business as usual?
It's business as usual. I mean, if 40 years, every government comes in, make a lot of promises, and then you vote them, they go, another one come, they revert a lot of gains, they change a lot of people, and the whole, you see, the sad thing is that the health system is becoming political playground. We don't really look at people who are committed providing that, but we want to please party members. It is time to start thinking of, if people have that capacity, the skill, people are committed. It is no more political issue. You see, I have been part of a lot of policies and discussion at the health sector. And the same thing is, every year we sit down, we discuss the same thing. Implementation, we sit down, report given, you don't really see a change. I don't know where we have to start, but that is what I'm saying, that I know that the president has a lot of goodwill. He's talking a lot about changing the country. Can he do it alone? Everybody, and all of us must play a role. If we don't change our attitude, we can never make it. And continuously, I'm saying that it is not curative, it is preventive.
I mean, what role does education play in the preventive?
You see, if you say education, education is part of prevention, health promotion. You see, you know, in the health sector, they have all these departments and all those units talking about whatever it is, but they are not effectively working because the motivation is not there. People are tired, they don't have resources, they don't have anybody punishing whether I come to work or not. There are some who are committed, but a number of them are not committed. You know, education is important. It's a tool. If I know what to do, I will do it. I will be motivated. But it also depends on the way you give me the education. You see, you must give it to me to internalize, to understand and implement what you want me to implement. If you come and tell me, do this, without letting me learn how to do it, you go, I don't understand. You go to healthcare for somebody has given you drugs. The person just said, take 1, 2, 3. The person didn't explain to you what this drug will do. You just go when you start swallowing it. It will not work. I think we need to see how we are going to really address our healthcare. And again, I know they have a lot of policies sitting at the health in Ministry of Health. How are we implementing those policies? We have different, even look at the chief's policy. We have the adolescent health policy. But all the policies are there. All the standard operation, the standards are there. But we are not implementing them. And so we have a problem. Achieving universal health coverage is a mirage. It's a mirage.
Is it one of those things that you have to tackle it holistically, or we can look at it sector by sector and say, look, let's sort infrastructure, let's move to technology, let's move to preventative, or it has to all simultaneously we start working on it, because then it becomes too big, so everybody runs away from it.
Yes, I think that we can start from somewhere and then scale up. You see, it also resources, but if you want to start all over everything, bringing everybody on board, you must really start where and then learn from it and scale it up. You see, we must go back to the good things that we have done in this country. It doesn't mean that what has worked before cannot work today. We must look at what can we bring on board and add. We are attending so many conferences.
Let me go to the phone and speak to Moses in Santa Maria. Hello, Moses.
Hello, sir.
Very good. Let me hear your contribution.
I think we have a problem with our educational system. Hello?
Let me talk.
I think we have a problem with our educational system. Because you see these nurses, they are trained, they look very smart in their uniforms, but they are not committed to work. They just come, sit down, chat, and then they just close. Because there are no avenues. People just want to go to a nursing training, become nurses, and then just kill people. Because even when I used to go to Kolebu with my mom, because my brother was a sickle cell, they dress very nicely. You see, every nurse skirt, the apparel is below the knee. But today, the nurses put on, I don't know if they are going for beauty contest or whatever, and you see a nurse who is bleaching. How on earth will a nurse bleach? I can't get it, because they just go to work, end of the month, they take pay. They close, earlier than scheduled, and then they go do part-time elsewhere. If I were the victim, I would have strangled that nurse, honestly.
Okay, Moses.
Thank you.
You're welcome. Rashid Inwa. Hello, Rashid.
Yeah, hello.
Yeah, Rashid, let me hear you.
Yeah, good evening, and many thanks for that wonderful job you are doing. PM Express is always the best program ever, and will continue to be.
Thank you.
Moving forward, if you look at there's this thing that procrastination is the thief of time. If we continue to push our problems in front, but we definitely go in the medium, you know what? There is always a problem across every sphere of our health sector. Starting from where we trade the people. In Ghana, for instance, before one could have the ambition or the conscience to go and read medicine, they say you should have aggregate something like single land or what is it? Well, over there, and then you write a WC and then you complete and then you have it. They will deny you from going to read medicine. At the end of the day, you go in and choose a social science subject and read. Meanwhile, we go to pick doctors all the way from Cuba, which they have not gotten those passes that we have had, but we bring them here to come and then use us to do practicals. At the end of the day, they will go back to their distance. They do the real medicine or the real patients there. So it's about time we take a critical look at our educational system. Someone who is having aggregate 15 or 14, wait, go read medicine. Why don't we give them the go ahead to read the medicine and then come out and then serve us very well? We have brain drain here and there, which a few people will read medicines and then 3 years, 4 years time, they will go back to United States or outside the country and then do their services, render their services to them because of brain drain.
Rashid, thank you very much, Rashid, on that one. Let's make it brief. But Rashid made a point in terms of staffing, doctor shortage and nurses shortage, even though there's a dichotomy there where nurses are finished, they want to come, but they are not being employed more. But how are we going to fill even the gap of doctors? Because if you look at how the population is growing, so we're going to need more doctors. Is there any plans anywhere to increase the numbers so that we meet?
I don't think increasing the numbers. Recently, the young doctors who finished their medical school, you know, they had to stay at home for some number of months before they were employed. I think the new government came in, and even some of my nieces were in the home doing their own thing until recently they were employed. So I don't think it is planning for them, you know. And another problem is that a lot of them don't want to go outside Accra and the cities. One of the healthcare providers in, is it Upper East or Upper West, told me something. He said, you know, I was transferred there 4 or 5 years ago. People I'm not motivated, nothing. They come, they see me there. No motive. You are just there doing what you want to do. He will be there when he's 6 years. He will just go and look for jobs somewhere and do. You see, we move them there, we dump them there. We don't give them any motivation. In the past, we were talking about bush allowance, maybe some even rent, something to support them. But currently, I don't think it's there. It is not actually the numbers. We have them. It is planning for them and making sure that they go to, and that is where we are talking about equity. They should go to where we need them. And I was Alliance for Reproductive Health did something and talked about this nurses allowance. The government shouldn't pay just blanket nurses allowance. It should be people who are willing to go and serve at where we need them after the training. If you just pay everybody money and after that they sit in Accra, what is it for? And so we should look at, are you willing to move to work?
The allowance should be given to those
who are willing to go to the grassroots to provide the service. It's not those who finish and then they sit in the cities. You see, there's a lot of political influence also. You transfer people and somebody will come and say, no, bring the... I think the politicians should leave people, the technocrats, to do their work. I think we should not politicize everything in this country. I think it is our biggest problem. One thing I want to say, which I have been lamenting about, is why should the government come and terminate the contract of a lot of people and bring new people? How many years will it take for those new people to know what has been... You have already invested in a lot... Are they not Ghanaians? Why should they resign? Why do you terminate their contract and say, all of you, move?
So let me go to the phone. Abdul Martin and Abdul Martin.
Yes, good evening.
Good evening.
Good evening to your business.
Great.
There's this program thing that's happening when my wife was brought to the hospital, the 7th of July 2017. In fact, the medical director called Dr. Gandao. He did a very marvelous job. In fact, my wife was brought in a situation where, according to the doctors, if she was not attended within the next 5 minutes, I would have lost my wife, that of my baby. But the man, when they called him, this 5 minutes, he came he just dashed in to the hospital and attended to her, in a speedy manner. But recently, I've been hearing that the government of the day is thinking of removing him because he's not towing the line of that particular government. I think this is unfortunate. It's about time that we leave technocrats to work as they are trained. If not, this man is a very, it's an asset to the people. He was trained to go back to home people.
Thank you. But so
I think that.
Yeah, so far it's a hearsay, so we won't say it factually. But let me go to Jawala in Tamale.
Hello?
Yeah, hello. Let me hear your thoughts.
Good evening, Nana.
Good evening.
Nana, I wanted to ask Madam that, like, I'm a teacher by profession. Like, we the teacher, we have like something like second supervisors. I don't know whether the nurses should also have something look like those who will monitor them to check or to check them and see whether they are in post or they are not on post. Because like the way the man just died, in fact, it's very sad. In fact, it's very sad. It's very sad. So I wanted to ask Madam whether they also have those who will monitor them and see whether they are in the work or they are not in the work. So that is my question.
Circuit supervisors who go around and check nurses. Any such thing? I haven't heard.
The question he's asking, in the education sector,
they do have.
They have circuit supervisors who really. My parents, my mother, my father are all teachers. They wake up and do their notes. When they hear, the circuit supervisors are coming, you must go to work. You must stay in the class. And it's that commitment. In the health sector, I think we have people who monitor. They also have the same structure, but the supervision is inadequate. They don't have the resources to do the supervision. I think in the education sector, there is some plan that make them get to do their work, apart from being committed. But I don't know if that is because monitoring and supervision in the health sector is inadequate. If it is happening, we will not hear this story at Senchi, where a retired disease control officer continue providing service and nobody was able to sack that man from there until people start dying. There is so much lapses in the system.
Do you think that the circuit supervisor model may help? I don't know.
No, it will help.
So that you pick an area and
exactly,
go around.
Exactly what the man said. I know so many of them who are so committed and they are committed to their work. Currently, I know some of them. They have their plans, and you see them just going around making sure that teachers do what they are supposed to do. You will not see teachers leaving the classroom. Some of them do it, but it's a limited number of them doing it. But in the health sector, like you're saying, there are some facilities, especially when you go to the chief zones and those places. You go there in the morning, you will sit there for hours, and then maybe the nurse or whoever it is has traveled to Accra for weekend and come back in the afternoon while patients are sitting. It's happening. It's lack of supervision, and we must make sure that it is done properly.
Would you do it, let's say, look, based on hospital, or you send an individual to mystery shop them?
No, you see, I'm very familiar with nursing. We have nurses, different grade of nurses, and they have their role to play based on their job description. Younger nurses, or maybe we have senior nurses and all those people, you are supposed to follow and supervise the various levels that you are supposed to do, but people are not doing what they're supposed to do. From the example that listening to all this, if there is strict supervision and you know that this is what I'm supposed to do, and if you don't do it, you are punished, You will not do it. Can't the health sector start holding on people's salary if you don't come to work? Can't they make sure that when you come to work, you register human resource? I mean, there are people who have to do what they're supposed to do. But the system, nobody is punishing, and that is the sector. So if you look at the private sector, you cannot be working in the private sector and say, I won't come to work. Can you say that you will not come to work here in Joy FM? You have to come. You see, so there is no punishment, there is no sanction. So people do what, and that is the problem with public sector.
The price we have paid all these years, and we still haven't woken up. Is there anything that would shake us again? I mean, cholera comes and goes, malaria, we've lived with it, we can't seem to shake it. We were spared Ebola, but I mean, with all these things that have come and gone, if we still haven't woken up that, oh, look, there's danger around the corner, let's get up, you know, I don't know, maybe warming. The last few years, if you can add teenage pregnancy, because the population is just going haywire. If it doesn't wake us up, what's going to wake us up?
You see, I don't know, we are Christian and Muslim kind. We think that everything, you pray, whether you sit down, God will do miracle. The churches are all over this spiritual. You see, like I said, it's being responsible. Because, you see, we talk about Ebola and we say it's God who has spared us. Well, maybe we have done something good somewhere. But, you see, look at the time the cholera came in and a lot of people died. And you see, we wait till something happens before you see everybody running. What we must be doing as a country is that there must be some plan, and we must follow our plan. We must monitor and assess what we are doing. You see, we are talking about Ghana beyond AIDS. Now that means that you are not going to depend a lot on donors. Now the donors also have the problem that we have, and they are giving us money, and that is why they are going back to their countries. And now we are we are middle low income. There are countries that are low and poorer. We have resources in Ghana, and for me it is important that whatever investment goes into the health sector, there must be monitoring and accountability, and we must make sure that we do what we're supposed to do. People who are supposed to be supervising should do their work. If you don't do it, you must be sacked. I mean, you don't need to sit there because whether I do it or not, nothing will happen.
So it's not easy to sack somebody in Ghana.
Well, we have
the chief,
those
the
are
assemblyman,
and we have to do it. People will hate you, people will talk about you, but you are doing the right thing. Because if the person is sitting there, not achieving results, you go there, the person is there, nothing is changing in the person's department, and we are there, people are dying. Look at this. You see, the people who have killed the number of people in Sechi, there must be people sacked. They should not come back into the system. If we don't start taking those decisions, we will remain where we are. People must be responsible. If you are taking salary every month, sit down, think, what have I done before I'm being paid this money? We must start thinking about it. Otherwise, poor people, the vulnerable people, will continue suffering and dying.
It's one message here. It says the healthcare system in Ghana, even in Accra, go to Mamomi Clinic and you weep. Leaves a lot to be desired. Poor facilities, lack of cutting-edge technology like breast cancer screening machines and prostate cancer screening machines, poor building, poor service, demotivated staff and poorly remunerated staff is the crisis facing the healthcare in Ghana. But our spineless politicians don't care. But the state of the healthcare in the country, because they have the luxury of treating themselves in the West Asia. Very sad. Thank you very much, Cecilia. It's been insightful, and tomorrow is World Health Day. You know what? Let's go down to the communities and within ourselves prevent ourselves from even getting sick. Thank you very much for watching. We'll be back to do this all over again.